Baton Medical Services was founded in 1972 in Southern Maryland to deliver quality health care to the underserved community. Due to its success, it expanded to 6 clinical facilities and serve over 16,000 patients annually. Southern Maryland has over 6 counties. However, this presentation will focus on the site that's located in Prince George's County, which is minutes away from Washington, D.C. You will find it highlighted in the dark blue area on the map. There are a lot of interesting facts regarding Prince George's County. Although the median income level is above the national average, the county still boasts a significant number of the working poor. Additionally, the county is the unhealthiest in Southern Maryland. The residents of this community are more likely to die and suffer from diabetes, sepsemia, heart, and kidney disease. Consequently, the populace is plagued with high cancer mortality rates. While the occurrences are relatively low, this could possibly indicate that the lack of screening and quality care is a factor. The mission of Baton Medical Services is to provide high-quality, accessible primary and preventative health care services in the community they serve. Their vision is to eliminate health disparities and improve the health of the community through provision of quality and affordable health care. And lastly, Baton's values are built upon respect for the patient, professionalism, and quality care. Allow me to preface that Baton's mission, philosophy, and core values embodies many public health activities. However, I will present number 7 in the assurance spectrum, which states it will connect its people to needed healthcare services and assures the provision of health care when otherwise unavailable. This relates to Baton for their commitment to reduce health disparities in the Prince George's County by providing access to health care at reasonable cost. The clinic accepts most insurance plans, payment arrangements, and a sliding fee scale according to income. Lastly, if one is unable to pay, there is free access to all provided services such as family medicine, substance abuse, behavioral health, dental, virtual technology, as well as diagnostics. Baton focuses on the prevention of disease and treating those disabilities. It can be defined under 3 categories: primary, secondary, and tertiary. The primary is the prevention of diseases and the intervention table. This is addressed by collaborating with religious groups, civic organizations, and government entities by creating awareness through campaigns on fighting diabetes, cancer, and heart disease. Some examples are activities through the distribution of literature, seminars, PSAs, and encouraging healthy behaviors such as eating habits, to name a few. Now, the secondary level of prevention is to minimize disease and unhealthy factors susceptible to harm. This category is illustrated by offering health screenings, preventative care, and such modes as health literacy. An example of health literacy is when 15-minute appointments are scheduled with the patients to discuss concerns to improve health outcomes. Also, Baton has medical outreach buses that travel to communities that are affected by chronic disease, low income, and cultural barriers. This is just 2 examples that address the health disparities and fill the gaps of preventative care. The last category is tertiary, which is the treatment of maladies and rehabilitation. Baton offers the latest technology and staffs a full range of practitioners that are able to treat or refer patients to partnering hospitals, ensuring the best medical outcomes. In conclusion, Greater Baton Health Center strives to become the golden standard of public health care in Prince George's County. They deliver promise to a healthier community with their clinical service centers as a hub for social and economic services. For more information, you may visit www.gbms.org.